Can I treat eye bags with lasers or PRP instead of surgery?
People often ask about treating their puffy under-eye bags non-surgically with skin rejuvenation treatments like creams, platelet-rich plasma or PRP, lasers, or thermal devices like radiofrequency and ultrasound devices. I'll discuss why non-surgical treatments can be effective for lower eyelid skin issues like wrinkles or discolorations, and how you can address under-eye bags with a minimally invasive approach. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery, and am a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice for over 25 years in New York City and Long Island. I treat puffy under-eye bags every day in my practice, as well as other lower eyelid skin issues such as wrinkles and dark circles under the eyes. I perform a wide range of eyelid procedures, including revision eyelid surgery for complications from surgery performed by other doctors. It's important to first establish the basis for the presence of puffy under-eye bags. As opposed to fluid-related puffiness associated with allergies and dietary salt intake, the type of eye bags that I treat in my practice are the types that are visible all the time. Eye bags that are always visible is caused by lower eyelid fat prolapse. This is a situation where the fat that's normally under your eyes has prolapsed or herniated forward, resulting in under-eye bags. Since the skin itself is not responsible for lower eyelid fat prolapse, it stands to reason that skin treatments can't actually treat under-eye bags. Under-eye bags often coexist with under-eye hollowness, so an injectable filler can be placed in the tear trough area to camouflage the prominence of herniated fat. But there's a limit in how much under-eye filler can be used, and beyond a certain level of prominence of lower eyelid fat prolapse, any placement of volume in this area can actually make the eye bags appear even larger and more prominent. The most definitive approach to treating eye bags is to sculpt and reduce the fat with a procedure called cosmetic lower eyelid blepharoplasty. If you're someone who has reservations when hearing the word surgery, you'll appreciate why I characterized my approach to under-eye bags as being minimally invasive. There are two ways to approach lower eyelid surgery. The first I'll describe is called a transcutaneous blepharoplasty. This is the more conventional approach where the fat pockets are accessed through an incision in the lower eyelid skin below the eyelashes. In order to access the lower eyelid fat compartments, the muscles supporting the lower eyelid have to be released and separated. Oftentimes, skin is removed for the purpose of addressing wrinkling under the eyes. Now, in my opinion, this type of surgery is more invasive and more likely to result in complications such as rounding or lower eyelid retraction due to weakening of the supporting structures responsible for the natural shape of the eye. In an effort to avoid this problem, a surgeon performing this type of procedure may actually attempt to tighten the lower eyelid, thereby making the eye appear smaller in width. This appearance of changing or losing the characteristic shape of the eye is often the most significant objection someone would have for undergoing lower eyelid surgery. In my practice, I routinely perform a lower eyelid blepharoplasty through a transconjunctival approach. This means that I don't make an external incision, but rather approach the under-eye bags from the inside of the eyelids. This is considered a more advanced technique which allows me to preserve the integrity of the structures which can be compromised with a transcutaneous or external approach. At the completion of this procedure, the anatomy simply appears as if you never had under-eye bags. My patients appreciate retaining their natural eye shape and being free of their under-eye bags. Naturally, the question arises about what to do about the wrinkles under the eyes. Well, wrinkles in the lower eyelids are typically caused by diminished skin quality, not an excess of skin quantity. So removing skin is not needed to treat wrinkles in the lower eyelids. Depending on a person's skin type, I will routinely use a fractional CO2 laser or radiofrequency device to improve the appearance of fine lines and wrinkles under the eyes. I further enhance the effectiveness of these treatments by using PRP, or platelet-rich plasma. My patients after this type of procedure can usually return to work in 1 week or less with minimal swelling or bruising. Ironically, patients have come to see me who have tried various non-surgical procedures such as injectables under their eyes and experienced weeks of bruising and swelling which were far greater than my patients typically experience with my transconjunctival approach to treating under-eye bags. I perform these procedures in my office operating facilities under local anesthesia with light IV sedation, thereby avoiding the risks and complications associated with general anesthesia. While skin treatments can't directly treat herniated fat responsible for under-eye bags, they can be used to optimize the results of a more definitive surgical procedure such as transconjunctival blepharoplasty. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.